Chris, this is quite shocking. I mean, we hear a lot of arguments from either side of the aisle about, why we should get universal health care, free health care, or Republicans saying, no, that would never work. But when it is personalized in this way, when you think of a child with cystic fibrosis and you think of a government agency, as the government agency in the UK is doing right now, denying that child medication that could potentially save their life because of the cost, that's really chilling no matter what side of the aisle you're on.
That's exactly right, Liz, and we've seen this for over 3 years now. Britain's National Health Service has refused to allow the National Health Service to sell or can be to patients, young patients with cystic fibrosis who could benefit from this treatment solely because government bureaucrats think it's too expensive.
I mean, it's literally the death panels that Sarah Palin got mocked for saying Obamacare would bring to the United States. There are government bureaucrats sitting behind a desk somewhere saying, well, this little girl is probably going to die in the next 10 years anyway, and so we don't want to spend the money to help increase the quality or even the length of her life because it seems too expensive for us, given, only incrementally how long it's going to help her live. That is so Orwellian. That is so frightening. That is so, I don't even know the right word to describe what it is, but I think there's no doubt that if this is happening in the UK's socialized healthcare system, it absolutely would happen here if we implemented Medicare for all.
Oh, I can guarantee it, Liz. In fact, one of the witnesses at House Democrats' hearing on single payer last week was Donald Berwick. Donald Berwick got knighted by Queen Elizabeth for his service to the National Health Service and specifically praised NICE, which is the government rationing body that denies patients, in this case Orkambi, or other expensive and life-saving drugs in Great Britain. And he said the question is not whether or not we ration, it's whether we ration with our eyes open. That's the kind of people that House Democrats are giving a platform to promote their single-payer agenda.
Right. And I hope the American people see this. I mean, that's why we talk about these stories on our show, because it sounds, well and good to hear free health care. Let's make it a universal. It's everyone's basic human right. That is not what government-run healthcare systems do. What they do is they decrease access, they increase costs, and they lead to rationing, which means the government is making a choice about your health and well-being, potentially your life, instead of you and your family and your doctors.